We are right on the edge of being able to cure blindness. But these medical miracles, they come with an absolutely breathtaking price tag. So, that leaves us with a huge dilemma. How do we decide who gets a cure that might cost $1 million?
And just to give you a sense of the scale here, in Europe alone, we're talking about 50 million people affected by vision loss. That is a staggering number, and it impacts everything: individuals, their families, and of course, entire economies.
But for so many of these people, this is a moment of just unbelievable hope. New gene therapies are coming out that don't just treat the symptoms. They're designed to be a one-time fix that addresses the root cause of certain diseases. This isn't just a small step forward. It's a total game changer.
Which, of course, brings us right back to that central question. When a health system is staring down a therapy that costs hundreds of thousands, maybe even millions of dollars, how on earth do you decide if it's worth it? It's not just about the price tag, it's about the value it brings.
And this is where things get really interesting. A new systematic review suggests that before we can even answer that question, we have to know the true cost of the disease itself. And here's the kicker. Our current understanding of that cost is patchy, it's outdated, and a lot of the time, it's just plain wrong.
Right. So before we can even think about evaluating a cure, we have to get a real, accurate handle on the problem we're trying to solve. So let's break down the true cost of blindness.
The review really zeroes in on a few key conditions. First up, you've got neovascular age-related macular degeneration, or NAMD, which mostly hits older adults. Then there's diabetic macular edema, or DME, a complication from diabetes that often affects people in their prime working years. And finally, inherited retinal diseases, which can show up as early as childhood. The key thing here is that each one has a totally different economic footprint.
So when we use this term, economic burden, what are we really talking about? Because, it's so much more than just the cost of doctor visits and what you pay at the pharmacy.
All right, let's really get into the weeds here and break this down, because understanding how these costs are categorized is the key to seeing the whole picture.
Okay, so this chart from the study lays it all out pretty clearly. It breaks the total cost into 4 big buckets. You've got the stuff you would expect, right? The direct medical and non-medical costs. But then you have these 2 other categories that are often hidden, and they are absolutely massive: the indirect and the intangible costs.
Let's just focus on these indirect costs for a second, because this is a part of the equation that is huge, but it gets overlooked all the time. This is the value of lost work, not just for the patient, but for their caregivers too. It's wages that aren't earned, hours that are cut, and even the economic value of a family member who has to step in and provide care instead of working. It's a gigantic piece of the puzzle.
All right, so now that we know what we're looking for, let's see what the numbers actually say across Europe. And this is where the picture starts to get really messy, but also very revealing.
So check out this chart. This is for NAVMD. That's the one affecting older folks. These bars show the total annual cost per patient in a few different countries. And whoa, look at that variation. It's all over the map. A recent study in Spain put it at over $28,000 per patient every single year. And for this group, the big costs are what you think: medical treatments and professional social care.
Okay, now let's flip the script. Look at DMO. This is the one that hits a younger, working-age crowd. Just look at the colors in these bars. See all that green? That's productivity loss. It's a completely different story.
So here's the big takeaway, right? The main thing driving the cost is totally different depending on who gets sick. For the older group with AMD, it's all about medical bills. But for the working-age folks with DMO, the biggest hit by far is lost productivity, people just not being able to work. And that distinction, it is absolutely everything.
But here's the big catch. The researchers point out, again and again, the data we have is just all over the place. Different studies use different methods, they measure different things, and you know what? A lot of them are incredibly old. I mean, many of these studies don't even account for anti-VEGF injections, which have been the standard treatment that completely changed the game for over a decade.
So you've got this world of messy, outdated data and really high ongoing costs. And into this chaos walks a potential game changer: gene therapy.
I mean, the whole concept is just revolutionary. Instead of coming in for injections for years and years, what if you could have one single treatment that goes in and fixes the problem at its genetic source? It's a shift away from just managing a disease to a potential one-and-done cure.
But a revolution like this? Well, it doesn't come cheap. The source paper points to Luxturna, which is a real gene therapy already out there in the US. And the price tag? Get ready for this. $450,000 per eye.
And this brings us right to the heart of the whole problem. How in the world do you evaluate if a revolutionary $500,000 treatment is worth it when the very data you're using to measure the disease is, well, flawed and decades old?
This is basically what health authorities have to do. It's called a Health Technology Assessment, or HTA. They're trying to do the math. They take that huge upfront cost of the new therapy, and they weigh it against all the cost it could prevent over a patient's entire lifetime. The medical bills, the lost productivity, the caregiver costs, all of it. But here's the thing. If your numbers for the costs it could save are wrong, then your whole calculation is wrong.
And honestly, you don't have to take my word for it. The authors of the review spell it out perfectly right in their conclusion. They say, this systematic literature review evidences the heterogeneity among studies. Several of the studies are outdated and unreflective of the disease's complexity. In other words, we're trying to make these enormous, multi-million-dollar decisions with a really blurry, incomplete picture.
So let's just recap the big challenges here. The data we have to rely on is often old, and it's missing modern treatments. It frequently ignores those massive indirect costs like lost wages, which is a huge deal for younger patients. The numbers are wildly different from country to country, so it's almost impossible to make a clear, unified policy. The bottom line? We desperately need better, more consistent research. And we need it now.
Which really just leaves us with this one final thought. It's one thing to add up medical bills and lost wages. We can put a number on that. But as science starts to give us these tools that feel like actual miracles, how do we measure the value of things that don't fit on a spreadsheet? The value of sight, of independence, the value of hope? How do we possibly measure that?